Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 113, NeuroMamaTribe and Empowering Women with MS with Dr. Irina Fedulow Plante. Enjoy the interview. Irina, it's such a pleasure to have you on the show and thanks for taking my invite.
Well, thank you for having me. I look forward to speaking with you today.
And before we actually start with the podcast, it would be very lovely if you could introduce yourself to the audience so they know who is with me on the podcast today.
Yeah, absolutely. Hello, everyone. My name is Dr. Irina Fedulow Plante. I'm a physical therapist with my board certification in Neurologic physical therapy. And I've been working with individuals with MS for well over 10 years in various settings. And recently, I began a company called NeuroMamaTribe, which is a resource for women with multiple sclerosis, addressing various hormonal stages of their lives and through wellness principles and also research to really optimize their quality of life for various stages.
Fantastic.
Mm-hmm.
What inspired you to start the NeuroMamaTribe and what makes it unique for women living with MS?
So I started NeuroMamaTribe about 5 years ago. This happened during the COVID pandemic. I had my first son during that time. And during that process, one of my former patients from the Bay Area reached out to me via email asking, do you know of anyone in these areas that can help me? And she has multiple sclerosis. And I learned that she had also a baby during the same time that I did. And she asked, well, would you be willing to see me virtually? And then one thing led to another, and just really understanding that for women, postpartum, pregnancy, all those different places, especially for women with neurologic presentations, there are so many more limitations with resources, education, all research, all these different things. So that really inspired me as a new mom as well of we have to do more for women. And this is what really helped catapult it to where it is today. And now I see many women with multiple sclerosis, even when they're younger, starting their menstrual cycle, even all the way up through menopause. And so it really just took off after that one woman who actually I still treat to this day. It's been 5 years and we still see each other weekly, virtually. And she really just helped, inspire that movement of what else could be done for women with MS.
Fantastic, yes, and especially in the US where distances are can be so extreme. I mean, in Germany we don't have that much of an issue, but still there are people on the countryside which have issues getting to the bigger cities. What are some common misconceptions about exercising with MS?
So right now, there has been a lot of changes, thankfully, when it comes to exercise recommendations, but still on the internet, you could see that individuals with MS, recommendation is at least 150 minutes or more of moderate exercise per week, plus resistance training 2 to 3 days a week. Now, that could look very overwhelming for individuals. So I believe that it's when you look online, there are so many variances of what the recommendations are, and it could be overwhelming thinking you have to achieve a certain amount of minutes, a certain amount with resistance, something else, instead of really thinking about how it will benefit you the best and where to start from there. And that could be often overwhelming given all the information that's out there and also the conflicting evidence that also could exist. So I think it's just a lot of confusion. And what is moderate? What does light exercise look like? What does it look like, or if you do daily activities and chores, those also take a lot of energy. How does that also play with your mobility? And really showing that because of MS, fatigue is a huge issue. And it's really helping to identify how can exercise be a benefit to you versus just looking at numbers and like looking at it as this one distinguished separate thing in your life that you have to add in. Like how can you make it more approachable? And that's something that I see a lot of.
Okay, yeah. You do interesting things. You integrate ballet, hippotherapy, yoga, and outdoor activities. How do these creative approaches benefit MS patients physically and emotionally?
So, to start off with ballet, a lot of the ladies I work with say that they always want to be a ballerina as a little girl. And that's something I hear so much. And there's a lot more in the research right now showing for boosting neuroplasticity, the brain's ability to rewire itself and even reduce inflammation. You think about nostalgia. You think about things from your past that you really enjoy doing or something that you always thought that you wanted to do. And ballet really offers that kind of emotional nostalgia and then this empowerment of, I'm doing something I've always thought I wanted to do and always thought that maybe I couldn't. But then with ballet, with the music, also, it's a community group. So, for example, I do online classes with the ladies that I work with, and we have different music. And it just shows like how that synchronicity with the brain's ability to match with the music, your movements. And women just love that sort of approach of, I could still do something that looks so challenging, but in an adaptive way. I'm empowered to do it.
Hmm.
And research is starting to show that it can help minimize ataxia. It can also improve balance, body awareness, and just help your overall well being. And that's why ballet is so fantastic. And you do it in any kind of position. And with hippotherapy, I grew up as a horse person. So for me, they look like big dogs to me. So it could be very intimidating to be around a horse. And also, they have nonverbal cues that are very powerful and they could be amazing teachers. So the individuals I work with, when we utilize equine movement, it's so empowering. They're bonding with this huge animal, they're working with this animal, and they're able to achieve all these other goals by interacting with the horse's movement and with the different beats of how the horse moves, different patterns that we do on the horses. And just like really bonding with this huge, majestic animal is where a lot of people come walking away feeling, you know what? If I could do things with a horse, there's a lot more I can do.
Hmm.
That's just what's so incredible of horses and how they can match our energies and really read our energy, and really match us and how they really teach us more about what we're feeling and thinking. And it's an amazing relationship with the horses. And for yoga, that one, there's so many different types of yoga that exist. And so for people with MS that I work with, they understand that they could do, restorative yoga, some vinyasa, and really understand there's so many different ways to really improve their body's flexibility and mobility and have this moment of calm that's very intrinsic to them. And that's what makes yoga so powerful. And again, it's very adaptive. It could be done anywhere and their own different kinds of practices. Like some days you have more energy, say, hey, I could do more of a vinyasa, Iyengar a little bit more. But other days, you know what? My body needs something a little bit calmer, like restorative or yin yoga. And so it's really listening to your body and not being able to do the same thing all the time. Again, that helps with reducing injuries, helps with function and reduce burnout, which is huge. And lastly, outdoor activities. And so for here, my wilderness first responder certification and taking individuals outside of multiple sclerosis, it's just teaching them to be in nature, how to read nature, the sensory environment, just very similar to hippotherapy. You're outdoors
Hmm.
and you're learning how to read the different cues of nature, hearing the birds, feeling the temperature changes, uneven surfaces, and modifying in a way, that may be necessary to safely be outdoors, like hiking or kayaking. And there's a lot of empowerment to see that, something different that many people with MS think I can't do anymore. But with planning, the right, adaptations and practice, problem solving, adaptability, a lot of things are quite possible. So that's why those different interventions, they really just, again, like speak to the individual of, you know what, you could do a lot. It just may take a little bit more time and forethought, but just really that empowerment piece and like really
Okay.
engage in the sensory environment along with that.
I love that.
Oh
That's
yeah,
really
it's
great
amazing.
because yeah, because I
Love to be
always say
outdoors.
I always say, you can reach all your goals. It might need a little bit more walkarounds or adaptation or I don't know preparation, but you can do so much. And I did Iyengar yoga for quite a long time. Unfortunately, I moved now back to my home city, and there is no Iyengar teacher nearby. But I loved Iyengar yoga. Ah, mm.
Iyengar is amazing, yes.
So, for someone newly diagnosed or feeling overwhelmed, what's one simple movement or routine you'd recommend starting with?
So I would first ask the individual, what do you find joy with? What kind of movements, activities, what speaks to you? And then a lot of times it looks very different for individuals. And so, like, for example, one individual that I worked with, she was in her 30s and she had a lot of finger issues, hand
Mhm,
coordination issues. And I asked her, like, what's something you always wanted to do? Like, what do you find joy? She's like, well, I always wanted to play the ukulele. And she said, but I'm too scared to. And I said, no, let's give it a try. Like, just try something. And she started to, sitting upright, doing
mhm,
stretches and sitting to make sure that she didn't get, too tight or, more stiffness and, immobility. And she started doing the ukulele. And, still a year later, she's, really enjoying it. She's doing more complex, patterns on it now. And so what I always like to ask is, what do you find joy with? What is something that really speaks to you? And then we work from there of what that looks like. And then also with the goal. She started playing the ukulele, her handwriting improved. She was able to
mhm,
type more on the computer for her job. So it's like thinking like, okay, how can this also apply to a functional perspective, but not just make it all about function, which is very vital, obviously, but as we know, if we fixate a lot on one thing that we think that we have to do versus actually finding joy with it, we're not going to want to do it.
mm,
Like,
yeah,
for example, my husband loves golf, and he's trying to get me to learn how to play golf, and I'm just like, there's other ways I prefer to be active, but I will try eventually."
Yeah, I don't know if you know
Yeah.
Ulrik Dalgas from Denmark, and I had him on the show, and we were talking about exercise or sport with MS, and yeah, we had that point that it's so important that you find joy in what you are doing. Otherwise, you won't keep on doing it. So maybe there is scientific evidence for a certain amount of sports activities, and not for others. But if you find joy playing ukulele and then it improves other things, fantastic. There's no
Exactly.
evidence, don't care on that part.
And also the evidence too, a lot of these studies are so small, and the thing is it's very controlled, where it's so important to have a research, I'm not dismissing it, but also think about for yourself, like, how to critically assess the research, what can you learn from it, but also what will motivate you? And that is such the foundation of it. What is your motivating factor? And also with the recommendations, what I always encourage individuals with MS to do is start slow. Start with just like two things at most, so it's not too overwhelming,
Mhm.
and then building on that. And then try, to alternate day to day so you don't get bored with it. And that's always important. Also, when we talk about fatigue, some days you may be more fatigued to do something, that takes a little bit more of the brain planning, so try something else. We always talk about alternatives. Like, for example, my patient with the ukulele, she was feeling too tired with fingers. So she always said, well, you know what? I like to do ballet. I always did it as a kid. I want to do it again. I said, okay, days you don't do ukulele, let's do a small ballet sequence with
Mhm.
some stretching and mobility just to improve. And it was just like those little things that I always encourage of not to overdo it. And then also be happy to experiment. See what speaks to you. It's not gonna be this one thing and that is it. It is okay to step away and say, "You know what? This may not work for me right now," or "I wanna try something else a little bit." Because with that consistency, you have to have that joy. So I always encourage consistency, like 2 days a week or 3 days a week is better than doing it 7 days in a row, and then for a month, you say, "No, I
Stop
don't
it,
wanna do
yes.
this anymore."
Yeah,
So
yeah,
it's
yeah.
always that encouragement also too about that routine is consistency, and you could spread it out more. And that is so important versus feeling you have to push everything into it constantly.
Absolutely. And there are so many options to train your balance or to train your
Oh,
strengths or to train
absolutely.
your mobility. So when it comes to, because I'm really a fan of evidence-based medicine, of course,
Mhm.
but there you can really check out, okay, I have issues with ABC. and I can do that in different variations. I don't have to do it in the way it was done in that evidence-based trial. Anyhow,
Mhm.
let's move on to hormones. How do hormonal changes like menstruation, pregnancy, or menopause impact MS symptoms or disease progression?
So, what we've seen in the research is that women that have their menstrual cycles earlier, there's a slightly higher chance of having MS in the near future with hormonal changes. So, it's a very small, but they're noticing those changes with, like, inflammation, menstrual cycle can increase that just because of the hormonal changes. And so that was something just to think about how hormones really can impact MS. So just like as like a foundational piece. But when we see hormonal changes like menstruation, a lot of women that I work with report that they have worsening of symptoms right before their menstrual cycle. And so a lot more bloating, fatigue, you could tell that there's changes, or they may feel that there may be an exacerbation approaching. And it's more of the menstrual cycle. And then once the cycle starts, symptoms seem to be alleviated much more. And something also in the literature that we are seeing more of is that women with MS, there may be a higher propensity or likelihood of having premenstrual dysphoric syndrome, the PMDD dysphoric disorder. And so that's to do with serotonin. And so there could be a worsening of menstruation's symptoms right before pregnancy. I mean, sorry, menstruation and then during menstruation. And so it's also more mood behavioral changes. And some women that I work with, they were diagnosed recently with PMDD. And so also working on those potential fluctuations. And so I could also talk about what we do with NeuroMamaTribe, so also at the resources and whatnot later. But what I ask a lot of my ladies that if they notice that there's a change with how they function right before a menstrual cycle or during, we track the symptoms for at least 3 to 6 months. And then afterwards, see what are the main symptoms that you are experiencing, what changes are you experiencing. We even adapt the exercise program.
Mhm.
Like, for example, right before menstruation, we do light yoga, light walking, swimming, something that's very, very low, that could be very kind of a lower energy just to help with like restorative, help reduce inflammation. And then during also periods, some women that I work with say, I feel more energy, I want to do a bit more. So we push more resistance training, a little bit more cardio. And during the luteal stage, right during ovulation, some women report a much higher spike in energy. So that's what we take advantage of one day, not overdoing it, but talking about, okay, how are you feeling energy wise, just to help push a little bit. And so it's really paying attention to the menstruation because in the recommendation guidelines, nothing talks about hormonal changes and how to adapt your exercises based on what you're experiencing. And so we do talk a lot about that, like symptoms that you're feeling during your cycle and how to modify your exercise routine based on where you are in your cycle. And a
Okay.
lot of women have reported that they've had reduction of those related symptoms like the bloating, the fatigue, the mood swings, even joint pain. That's a
Mhm.
big one that women have reported. And they said by modifying their activities throughout the month consistently for at least 3 to 5 months for that after tracking their periods. And during
Mhm.
that time, they've noticed a reduction in those symptoms, which has been really fantastic to see. So I
Great.
think it's really paying attention to our bodies and what's going on. And during pregnancy, many women report that there's a significant reduction in their symptoms because that neuroprotective hormones that come with the growing fetus. So a lot of women that I work with that are pregnant, they describe having the best energy right now and doing all these things. And so, the first and second trimester, it really depends on symptoms. First trimester, many women report nausea, fatigue, just because of it, the hormonal changes. And so we do more like the low kind of endurance activities, making sure to help manage symptoms and still stay active for like flexibility, mobility, brisk walking, those sorts of things. And the second trimester, we tend to focus more on like weight training because that's like the golden trimester. Energy comes back before the belly gets a lot large, a
Mhm.
lot growing a lot more. And we talk more also about, joint stability because we have relaxin, different hormones that make us more flexible in our pregnancy and really honing in on stability work. That
Mhm.
second trimester, I do have a lot of my ladies. That's what we do. is really just help educate. So after a baby is born, they already have this foundation of, okay, second trimester exercises, even maybe first trimester, this is what we worked on. I could bring those back now postpartum, and they have this sense of empowerment of, okay, I have a plan how to stay active still. I know what to look for, because trying to learn new exercises with a newborn,
Yeah.
not the most realistic. You want to sleep a lot of the time and rest, and not look up exercises for yourself. Like, it's not I was the same
Or
way
take
too.
a shower.
Yeah, you take a shower, brush your teeth,
Yeah.
wash your face, anything, change your
Eat
clothes.
something.
Yeah, change your clothing, something.
Mhm.
And so it's really just that empowerment piece of what looks familiar already. And then the third trimester, it's more really making sure to modify activities because of balance issues.
Mhm.
Because as a growing baby, your center of gravity changes. And so we talk a lot more about gentle mobility work, still being functional with exercises, but really making sure that we think about balance as that huge approach, and really that education with the healthcare team as they're getting ready for the baby. So that's what we do a lot of. And so some women do have some exacerbations during pregnancy. It is more rare, but I do know that from the OBGYNs, they recommend they could do steroids the first or second trimester potentially, but third trimester, they usually don't recommend it. And again, I'm not the physician. It's just from what I've been told, seen from women that I work with. And so typically then they're more monitored by their physicians. And so one thing that I do with NeuroMamaTribe is we have a sheet at the beginning of pregnancy of what their MS previous symptoms were
Mhm.
and some newer symptoms that they have. So it's this whole document that they already have, so they could already compare. Because sometimes when you're pregnant, you're tired, you get anxious, you may forget more things, and that is
Mhm.
okay. That's normal. And so by having this document, it helps just the entire medical team to really see, okay, is this an exacerbation? Is this maybe pregnancy related? So
Mhm.
it helps get a deeper dive in there for women of, is this what this may be related to? And lastly, for menopause, a lot of women, as they start to even go perimenopause, which could start in your 30s, this hormonal shift of reduction in estrogen. And so what happens there is women that I work with, they talk about more, kind of mood swings. Anxiety is a huge one that a lot of women report, and having more joint pain, more fatigue, also weight gain, and saying that it's harder to lose the weight suddenly. It never was before. And so that can impact MS with, bone density. Obviously, that's a huge conversation piece I have with ladies that are already in their 30s, talking about what to do to help improve bone density.
Mhm.
When you're not feeling well with hormonal changes, we tend to be more sedentary. And that, could create this, domino effect of other negative things. And so with like the perimenopause and menopause, there could be an exacerbation of the symptoms and feeling like there's more inflammation. And so that's typically what a lot that I notice with my ladies, starting like in their mid 30s, all the way up through their 50s that I work with.
Okay, cool.
Mhm.
Thank you for
I know that was a lot of
such a
like different.
Yes, I mean, my question was like that, so
I
thank
know,
you
and there's
for
very
diving deep, into the topic.
oh, I could dive very deep in this course, but that would take like
So
5 more hours.
yeah, yeah, 1 hour,
We don't have
is
time.
normally the maximum.
I know,
So
right?
what are some practical ways women with MS can manage symptom fluctuation during hormonal transitions? I mean, you already explained it a bit.
Mhm. Absolutely. So first is tracking your symptoms and doing it at least for a few months to see what the potential pattern is. And next is adding exercises that are pertinent to you. And so one that I really encourage women is weight training, whether that's using your own body weight or weights. That's very important because we see in the research that for women with hormonal changes or kind of progressing more towards later ages, having weight training reduces inflammation significantly and really helps with bone density. And that's something that we really want to encourage because also women with MS have a higher risk of osteoporosis
Mhm,
because also there's, with spasticity, decreased mobility, that can also play a role with the hormonal changes and inflammation. So it's really this education on weight training that's very important. And something that I don't think that we address often enough is how our nervous system responds to changes. Because a lot of times we discuss, oh, it's just anxiety. Oh, it's just stress. But it's like, well, what is causing our nervous systems to respond in that kind of way? And so what we do a lot, with my practice is discuss ways of calming activities. Because a lot of times in our day and age now, we have phones, we have iPads, we have tablets, computers, everything. So we always have this expectation to always be on.
Hmm.
Also, we have children, family members that we're helping with our jobs. We're always expected to be on. But what about allowing our nervous systems to really better self-regulate? And so what we do a lot is learning how to ground ourselves. And so some is like a tapping technique. And so you tap different areas, like
Hmm.
on your wrist, also in the middle as well of your forehead. And it just helps recalibrate your nervous system to say, okay, we can calm down a little bit and not think about the 20 million things I need to get done.
Hmm.
We're always thinking, especially as women, we're always thinking 10 steps ahead, what needs to get done. And it's just like really teaching, like, okay, what am I feeling right now? How can I minimize this kind of fight response or this stress response? And so it's talking about, what works with you. Some women do dry brushing, and that helps the lymphatic system. So before you go in the shower, you do these small circle motions with a
Hmm.
dry brush, and it's very calming. So it's like learning what these techniques speak to me. Or even like walking outside grounding, walking barefoot,
Hmm.
someplace safe, of course, probably in your own backyard, not a park. But then just different ways, even for 5 minutes, just letting your brain take a breather. And it doesn't have to be for hours, but even 2 to 5 minutes at a time, just a few times a day. And a lot of women that I work with say it's been very effective. Because a lot of times we think we have to do 30 minutes meditation on a rock quietly.
Hmm.
Challenging to do that, and a lot of people are like, "I can't do that." And I totally understand why, but even taking 2 minutes at a time, just quietly drinking your tea and not having your phone next to you, but just
Yeah.
quietly enjoying that moment, being mindful of that moment. That's where also it's like that regulation of the nervous system that I feel that a lot of us as practitioners, we kind of forget about. It's like, "Oh, we have to be functional,
Hmm.
productive, functional." It's like, no, like, how can we really help women with that foundation? And it's made a huge difference with a lot of women that I work with. And we're kind of empowering them again to really feel like I could really harness my nervous system in a positive way. And
Sounds
that's
very
something that, yeah, that's what,
reasonable.
yes, very reasonable. That's what it is. Let's be reasonable things. If I say
Sounds,
do yoga for an hour and a half every day, no one's going to do it.
yeah,
Yep.
very, very, very few. And the ones that can do, they don't have issues, I guess.
Or anybody, yeah. And it's just like, but it's unpractical,
Hmm.
and just it's these meaningful small things throughout your day to keep that consistency.
Yeah. Okay. So, what should women with MS know about family planning, pregnancy, and postpartum care from a physical therapy perspective?
So, what's really important to just acknowledge is that many women with MS were told not that long ago, maybe 20, 30 years ago, it's not safe to have children. And we know that now that could not be farther from the truth. And what's important from a physical therapy perspective is start pelvic floor exercises soon, as soon as you can, even if you're not pregnant, but you're in family planning, thinking maybe the next couple of years, I'd love to start a family. Start with your pelvic floor.
Hmm.
And so that's very, very important to do because with MS, there's higher rates of, incontinence, pelvic floor issues, also with, intimacy as well. Pelvic floor exercises are so important. And so I always recommend that you could start them as soon as you can. And also making sure to work on function. That's huge. And so different things during the day, like women that are planning to get pregnant, we do a lot of exercises of how to pick up a baby, how to modify your heights, these sorts of modifications to really help conserve your energy as a new mom. What does that look like? And we do a lot of that functional things, even exercises. We take our arm, how we go back like this tricep here, and then move here. Because you think about if you're in a car, your child wants something, you have to have that flexibility and that arm strength to
Hmm.
do it. So it's really thinking about as, women are starting to get pregnant, even like how to hold the baby. What does that look like? And so we do a lot of those things. And so pelvic floor is huge, and then functional activities to get moving. And then also, like I mentioned before, about the nervous system and really identifying those like stressors that you have and like how to help, recalibrate.
Mhm.
Because during, family planning, there's a lot of anxiety that can go into it and a lot of stress trying to get pregnant, or what does that look like? Pregnancy. There's also a
Mhm.
lot that comes with it, a lot of anxiety about the unknowns of having kids. There's no experience like it. And so it's really it's really trying to understand, like, okay, if I feel that I'm going to start getting stressed out a lot more, my nervous system, that fight response is happening more, what can I do in the moment to help minimize that? That in turn reduces inflammation. That can help reduce exacerbations. And so that's where we're really thinking ahead of, like, planning from that perspective, and even, like, finding things that are fun that you could do with your kids. And so that's in that, even, like, doing dance in the living room, what does that look like with your balance? And
Mhm.
so we talk about that, like, okay, do you have to be next to the sofa to lightly hold on to it as you're dancing? Or even activities. What I always like to encourage women to talk about with their children is exercise is good and it's part of our routine. Like, a lot of my ladies love to do yoga. Their kids come up and do yoga next to them on the floor.
Mhm.
They make it with this whole collaborative effort, and then the kids get involved with it. And so then they see, oh, mommy's working out or exercising. I want to do something similar. And so it's teaching that you could incorporate different things. It doesn't have to be so separate. And some days you'll be able to exercise by yourself without your children. Other days, that may not be a possibility. And that's okay. And like, we're in that flexibility of what you could do. And so,
Yeah.
or even if you're at the kitchen, you're doing some dishes or something, do some squats. If you
Mhm.
feel that you can't do exercise, like, how can you add exercise during your day if you feel that it can't be as formal anymore? And so it's just thinking that adaptability of what that looks like as well.
I like that.
So we
Um,
talk a lot about that.
yeah, yeah, that's very good. We do some training for people who sit a lot in front of the computer right now with my kid. She doesn't like that too much. She prefers the salsa training, but
Yeah.
at least she is trying to do some of the exercises, the bigger one. So, how do you incorporate wellness practices like breath work or breath work, mindfulness or body awareness into physical therapy?
So I always start with an educational talk with each of the patients that I work with. And so by doing that, it gives the expectation of these are different things that we'll be looking at. And so even before we get started, we do breath work, just see where we are. And then even during the exercises, sometimes what we do is like the mindfulness of something, just take a break for a minute and then go back to exercise after. Because sometimes that mental fatigue, especially if you're a mom or mom to be, you're trying to exercise, manage all these things. It's just, you move a little bit and then you step back as you need to. And we talk about just for this like foundation of different things that we'll be doing. And I always like to ask what they would prefer to do. Some women love to do meditation for 5 minutes, on the floor, have her hand over your heart. Other women I work with say, I will never want to do that. And so it's just like that mindfulness of what are you doing in that moment, and really trying to create that education, because when your nervous system, you have a better connection to it. Because if you're exercising, for example, and you're rushing, like, oh, I need to cook dinner, I have to pick something up, I need to do this, you're not getting that same engagement from your nervous system and that same benefit. And so I always like to educate patients that by being more mindful of what you're doing right now, not rushing and, not like, over analyzing every little movement, but like, okay, I'm in my body. My breath is calm. I'm gently moving in this direction. Hey, this doesn't feel too good for my body. I'm going to modify and do something else and be in that moment to focus. That plays a huge role, and it helps reduction in fall risk. It helps with also improving overall energy during the day. And so that's what I really try to encourage with my patients on education. Right as I start with someone new, we discuss all these different things as part of the evaluation.
Okay, that's great. Yes. And I
Yeah.
sometimes realize when I have to breathe more slowly and deeper, and yes, and that's already a first step, you know.
Oh,
Um,
absolutely. And it's just simple things. And that's
yeah.
what we're trying to encourage. It's nothing this complicated, all these things you have to do, but it's just these little things during the day just to
Mhm.
help. And it's just even like 1 minute. And even this one meditation teacher said that if you're too busy to meditate for 5 minutes, try for 20.
Mhm.
And so the thought is that, oh, I'm too busy, but it's like, no, like, let's sit and like, why do you feel that even that short time, what's going on and what can you do then differently to feel that you have that time? You can calmly, have that sense of calmness during
Yeah.
that time and that present.
So, yeah, why is it important to look beyond just the physical symptoms and take a whole person's approach in MS care? I mean, you already explained quite a bit, but
No, absolutely.
summarizing it.
Absolutely. And so because everyone's different, everyone comes with a different background, different story. And it's so important to think about that because if you think just unidimensional of just function, you're not engaging with the individual. You're not really thinking about that empowerment piece. You're not thinking about what would motivate this person to do something. And that just looks so different for everybody. And it's always like this problem solving and just like, adapting in that moment. Because I always like to say that, to my patients, you know what? I'm probably gonna make some mistakes with you about what I think that, would recommend, but then you know what? We problem solve together. And like it's this dialogue that, we're in this together in the sense of giving ideas and then what speaks to you as well. Sometimes I like to push a little bit, like, you know what? Get out of your comfort zone just a little bit safely. Like, let's just see, like, when I have a better relationship or stronger, I already know the individual. I'm not going to say at the first day, hey, try this new crazy thing that I want you. It's like, but you build into that and you start seeing those different components and what speaks to each person. Because, what may work for one person would be very different for somebody else. And if you just look at that one, kind of that tunnel vision, you're not getting the whole picture. The brain is so dynamic. It's so, has so much like variance to it. And just by doing that and not just assigning a diagnosis to somebody and really looking at the individual of how to empower them. Like one of my ladies, she thought she would never ski again.
Mhm.
And I said, "You know what?" And she has small kids. And she said, "I wanna go to the Dolomites and ski with them there." And that was always her dream. And we took about 2 years after postpartum, did different things together and, like, really problem solved, "Okay, let's try to adapt this, do that, when you go there, maybe try a lesson," just different things to prepare her. And she did it this past
Cool.
winter. And it's just like, you have to think about that. And that really worked for her. She wanted to do that.
Mhm.
And just like, you know what? Let's figure out. Let's see what we could do to get there. And she did it with her kids. And that was so important to her to be able to do that. And so, and then for somebody else, it would be, you know what? I want to be able to stand up in my house and walk with my children using the proper, device. It's
Mhm.
just different sorts of levels of function and really seeing what is meaningful to that person.
Yeah.
Because if you don't, it's not going to matter what you say, what you hope to recommend. You have to think about the person.
Yeah. Absolutely. Absolutely. So, let's talk a little bit more about empowerment. How can women with MS recognize when they need professional rehab support versus doing exercises at home?
So that's a very good question. So what that looks like is they're not making gains. And so they feel that they're trying to do these activities, but they're not seeing improvements with what their goals are, or they're feeling burned out, or there's more injuries, or there's a change to their symptoms, like there's more imbalance, a higher fall risk, dizziness, those different things. That's when it's very important to go seek out a professional to help you. And also, if you want to try something that's different that you're very unfamiliar with, or you want to progress or ask about a new sort of equipment, something else, instead of looking at YouTube how to do it, go talk to a professional instead. And those are the key things that I would say when to seek professional care
Mhm. Okay.
versus trying to do it at home.
Yeah. Can you share what resources or types of support NeuroMamaTribe offers for women at different life stages?
Absolutely. So I offer wellness consultations for women with MS. And so what that looks like is where you are in your transition when it comes to hormones and it's very holistic wellness practices. And for physical therapy, I'm licensed in California and also getting licensed in Nevada, so I could do physical therapy for women with MS in both those states.
Mhm.
And that's what I do right now, and they're all cash pay. But a very exciting thing that I'm doing right now is putting together some written resources I'm getting copyrights on. So stay tuned within a month on the website. But it's really to help like with an ebook for women with MS and working at different stages. So it's going to be free, which is exciting. And it should be up on the website soon, as well as also different courses. So I'm in the process of filming them. And it's showing of different life stages and kind of like this preparatory kind of guidebook of exercises, what to look for. And the goal is to really make it, in a sense, individualistic in a sense. So then women could walk away feeling empowered, like, hey, this is for me, not this like generalized umbrella terms. And I'm also doing more talks for women with MS right now for different, hospital systems everywhere, just to really educate on how to better, bridge this gap. What does this look like? So there's courses, there's some written things that are actually in the quite almost finished right now, which is very exciting, and mostly consultations. I'm doing also some group classes for women, like different talks about what this looks like and trying to
Fantastic.
so there's a lot of educational things coming out in the next couple months, which is exciting.
And it depends when you, dear listener, listening to that podcast, because maybe it's out there already.
Exactly. Yeah, could be, very much so.
Okay, so let's move on to the quickfire Q&A session. Complete the sentence. For me, multiple sclerosis is?
This was a tricky one. I was thinking about this one because, I don't have multiple sclerosis, so I never wanted to say this is what this looks like. But for me, when I think about multiple sclerosis, I just think about these very incredible human beings and just how really, given this diagnosis and how to find this beautiful light when there was darkness with it. And I just see these women becoming mothers and just how they're taking in stride. There's exacerbations, there's other things, and just taking everything, just going forward, not feeling sorry for themselves, and just, you know what? This is the card that I'm dealt, and just this power that you women have. Like, I'm very humbled. Like, sometimes I think I have a bad day with my kids, and I'm like, you know what? Life's not bad. And it's just very humbling of just how incredible all of you are for what you do for your families. And that's what I think about is strength and just like this stoicness. That's what I think about.
Thank you. What development would you like to see in the field of multiple sclerosis in the next 5 years?
So, for a development, I would like to see more of different medications. So, it's disease modifying therapies and looking more at different ways to make it holistic and looking at different ways that you could see how to better treat MS and to continue on with that fight. And just also encouraging really more of like the holistic approaches that go with it and having it be more of these treatments, having that holistic aspect to it along with the DMTs.
Mhm. Okay,
Or
so
yeah.
finally, what message of hope or encouragement would you like to share with the individuals living with MS?
What I would like to say for the message is your brain is capable of more than what you think. We only understand maybe 10, 20% of what the brain could do. And just to really understand that it's your brain, it's your body, and it's capable of much more than what we give it often credit for. So keep pushing, looking for ways to optimize your brain health, and just to always keep that flexibility and adaptability. That's what I would
Yeah,
say.
yeah, good one. How and where can interested people follow your activities? And where can they find you on the internet, in NeuroMamaTribe?
So I have my website, neuromamatribe.com, so they could go there for more resources. And my Instagram, I could be much better with it. So I like to see
Me
people.
too.
I like to work with people. I like to talk with people. So doing posts, I'm just I need to be better with it. And so I have a few more things coming out educational wise. And so the website will be the great place to see these other resources that I'm producing And I'm also putting together my own LinkedIn page. And so it's basically done. So the LinkedIn for NeuroMamaTribe will be out for the next week or two, neuromamatribe.com. And my Instagram that I will be making more improvements on to be more. But I just, everyone's different. And I
Yeah,
just,
and it's more important to work with the people than to do Instagram.
exactly. And I love working with you ladies. So
Mm.
that's what I find so much joy with. And that's where we're at as of right now. But Instagram, I will be better with.
Okay, okay. Irina, thank you very much. Thank you very much for everything you are doing. It's really great, and it was a very interesting talk. And I have to check out NeuroMamaTribe myself again and again. There were lots of good tips and hints. And yeah, thank you, and good luck with all the ladies you are working together with. I think they can learn a lot, and the good thing is you are thinking about their goals and not your goals, and then combine it with your knowledge. So that's really great. That's important,
Oh,
and
it's been
that
a
can
wonderful
help a lot
experience.
and make a difference.
I mean, it's been an incredible experience and journey. 5 years ago, if you asked me if I was doing this, I have no idea. And that's what the beauty of it. It's just you never know where your path takes you. And then you ignite this new passion and you just keep going.
Absolutely.
Mhm.
Okay. So thank you.
Well, thank you very much too. Well, have a wonderful evening, and thank you again. I really enjoyed this a lot.
Me too. Bye bye.
All right, bye-bye.
I hope you enjoyed the interview and got inspired how individual care can really make a difference. So check out the website of Irina and stay tuned. And as always, stay as positive and active as possible. And see you next time. Bye. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.